Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Today we'll be talking about obesity and bariatric surgery with board-certified general surgeon Dr. Karen McFarlane. Dr. McFarlane, welcome back to Today's Health.
Thank you for having me.
Now let's start with obesity. How is obesity defined?
Obesity is defined as a certain weight, what we look into kilograms, over the height of the patient, which we call meters squared. Very scientific, but what's more important is when patients start developing what we call side effects of obesity. We call it morbidities. So for what we call the National Health Institute, a BMI over 30 is defined as obesity. And that's when we start seeing additional problems that we look into.
Are there different levels of obesity?
Absolutely. So a patient is defined as being overweight when their BMI is over 25. That in itself is over 60% of Americans. When we look at a BMI over 30, that's already a third of Americans. And we're seeing a greater rise even amongst children.
Why is obesity mentioned in the news so much?
Obesity in itself has become a pandemic, not just the United States, but worldwide. In America, again, a third of Americans are affected. And more importantly, it's the comorbidities that are associated with it. High blood pressure, diabetes, and the cost of obesity is well over $120 billion and counting. And at this point, we have many societies that are coming together to address it as a global problem.
Now you mentioned that high blood pressure and diabetes can occur because of obesity. Are there any other common health issues associated with being obese?
Well, especially for women, we see infertility. Next, we see for the orthopedic providers, lower back pain, joint replacements, whether of the knees, hips. We also see what's called obstructive sleep apnea, which we've identified as a silent killer.
How does bariatric surgery help to treat obesity?
We deal with the primary problem, which is at a certain set point of a weight, once your body starts handling excess weight, it becomes more problematic, and your body then expresses these we call inflammation. So if we can remove the source, which is helping patients lose weight, and more importantly is sustained weight loss, that's when we start to see improvements.
Who is eligible for bariatric surgery?
Most of it is determined by your insurance company. So for the most part, it's a body mass index over 35. But you need to have additional problems, such as we talked about the comorbidities, high blood pressure, diabetes, etc. When your body mass index is over 40, this usually corresponds to 80 to 100 pounds overweight. Most insurance companies will allow, but there are other things that are included, which is you have to do what's called dietary weight loss with your providers, etc.
Are there certain steps that patients would have to take in order to be approved for the process of having bariatric surgery?
Yes. Commonly, there has to be a consistent monthly follow-up. It's called medical supervised weight loss. Not to be confused with medical weight loss program. The time frame can be anywhere between 3 months. Commonly, we see 6 months. Some will request up to a year. And if you have additional problems, such as your heart, we call it clearances or evaluation by those providers.
Now, what types of bariatric surgeries are available at McLaren Port Huron?
Well, we mimic what's going nationwide. The top 3 procedures in the world, not only in the United States, include the sleeve gastrectomy, which is relatively new, the adjustable gastric band, which is still present, and the historical gastric bypass.
Dr. McFarlane, this is great information. We'll talk about these procedures when we get back from a break.